That potentially dangerous flu virus is hitting our state hard. We've had one child death so far and dozens of people sent to the hospital. And that's because things are a little different this year. Our Joy Wang spoke with a doctor who specializes in infectious diseases about what we're seeing. Joy.
Well, Steve, usually January is the start of flu season. But this year, Dr. Meghan Brett with UNM Hospital tells me flu season started earlier. And usually influenza A shows up before influenza B. But this year, B is the first to show up. And that's the one affecting children more than adults.
Most commonly, people will present with a runny nose, sore throat, and then a cough and fever. So there's no difference in terms of how people show up. It's just more about the testing.
Now, if you haven't had the flu and still got a cold, there's a reason for that, too. Other respiratory viruses are also popping up this time of year, including the common cold, as well as RSV. That stands for Respiratory Syncytial Virus, and it can hit children under 6 months old very hard. The CDC has tested about double the number of people in New Mexico in the last couple months. The percentage of those infected has stayed at just under 10%.
RSV is something that shows up every year. It typically starts to take off in January. This year we're seeing it in December. It's not clear whether that's because we're testing more often or because there's actually more disease around.
So what can you do to protect yourself? Well, it's not too late to get the flu shot. Of course, you always want to wash your hands, maybe wear a mask, and that's especially important because the flu virus can live on surfaces for up to 7 days.
Yeah, and people who've had the flu shot know it's not always effective.
That's right. It's still better than no flu shot, according to doctors. And the reason it's not always as effective is because people have to kind of predict that strain about a year before the flu season even starts.
All right, Joy, good to know. Thank you.